Hello, you are watching and listening to the Nomiki Show. I am Nomiki Konst. Hope everybody is healthy and safe and quarantined and practicing social distancing. And whatever, we hope that you have toilet paper and paper towels and disinfectant, because we know these are the things that people, I guess, are in demand right now, in more ways than one. I want to thank you all who have subscribed and become patrons to our show. Before we go to our guest, these are really, really strange times we're living in, and we're not sure where the economy is going to go. And I think that's why it's super important that we continue to give whatever we can. And if we can give more, if we're able to, give more to independent media so more people have access to it, especially those who are going to be affected by the economy. So I'm just saying thank you to everybody who has invested in this show. We are building a studio at home since we're not able to tape that in Brooklyn anymore. And, just thank you, because independent media is also, it's a small business for a lot of these folks. And we are struggling to pay our bills when we rely on small dollar donations. So if you're not a patron already, please check out patreon.com/the Nomiki Show. And if you like our videos and like learning about the state of the Democratic Party and how the establishment functions, and now in the case of COVID, we're trying to offer unique perspectives on this crisis that we're facing, then please subscribe and hit like and definitely share. The next guest that we have today is, she's a good friend of mine, and I work with her very closely, and she's telling me about her stories, and I asked her today if she'd be willing to come on and share her experience. Dominique Shuminova is the political director for Matriarch. Matriarch is an organization we feature regularly on the show. I am on the board of Matriarch. It is an organization dedicated to supporting progressive working class women running for Congress. And Dominique is also, are you overdue at this point?
Are you 40 weeks pregnant, so I'm due. Yep, it's eviction time.
Eviction time. So Dominique, not only are you pregnant and about to deliver a baby during the COVID crisis, you are also in the area that is one of the major hotspots of the country, not just New York. You're in Westchester County, in the area where the hospital is being used for the first cases in New York State. So can you describe just a little bit about where you are, and then we'll talk about how you plan on giving birth right now?
I'm less than a mile away from Lawrence Hospital in Bronxville, which is where I had my son 5 years ago. That is also the hospital where the first case, I believe in New York, where he first went to seek treatment. The gentleman lived in New Rochelle, which is a couple of towns over. They then made this containment zone around New Rochelle, which was not really contained because people kept going to the same grocery stores, taking the Metro North, taking the subway. The gentleman who was the patient zero who sought treatment at this hospital a few weeks ago, I believe is now in a coma, but his entire, his rabbi got sick. The guy that drove him to the hospital got sick. They basically drew a 1 mile radius around his house and called it the containment zone, which is about a mile from where I am. I believe that hospital got thoroughly disinfected since then. It's more just that there are so many more cases than we know about because so few people really have been tested here, just like everywhere else. Now the Javits Center is getting turned into a 1,000-bed hospital. All the retired RNs are getting re-enlisted. So things are basically progressing by the day. Had my hopefully last OB appointment yesterday for my 40-week appointment, and they informed me that the hospital group has changed their policy, and you're no longer allowed a birth partner or any visitors, that every woman who goes into labor gets tested upon arrival, and that there is also the possibility that if you test positive that you get separated from your newborn. So that was a lot of information. It was also a really different appointment than my previous appointment 6 days earlier, where I was sitting with no mask and no gloves with 8 other patients in the waiting room. This time the nurses were in full hazmat gear. Like I'm talking like eye shield, like fluid masks, like full body, which is, already feels a little impersonal as well if you're thinking about the birthing experience and, needing comfort and someone to sort of hold your hand.
So you're saying Okay, so you could give birth while we're on camera right now.
My husband did joke about that. It's like, wait 20 minutes.
Much, but so because it might induce birth, but you're saying that when you arrive at the hospital, they're going to test you immediately.
Right.
Okay, so even if you test positive, does that transfer to your baby? We don't know a lot about this virus, but is it something where, I mean, they're saying they want to separate you from the baby?
Yeah.
Would you?
It seems the main concern is not that it would pass the placenta. Like if I say I had it right now, there would be very little likelihood that I'm pregnant with a girl, that the daughter that I'm carrying would also have it. What they're most worried about is that the baby could contract it right after birth. So they would, you'd give birth and they would whisk the baby away immediately without any kind of contact with the mother, which of course, I feel fine. I have no symptoms. But 7 days ago, I was in a waiting room with 8 other people. Like, there's no way to know, right? You've got asymptomatic cases. And so I think that that's my bigger fear. My husband was with me 5 years ago when I had my son. I will say that nurses, they're kind of like, I'll check you again in 6 hours, and they leave you to your own devices. So having somebody there with you, even if they're not a trained doula, is nice versus being by yourself. But I am kind of comfortable now with the fact that my husband is going to be with my son. Our plans anyway of my son staying with my in-laws or with friends sort of, fell through under the circumstances. It didn't make sense for him to perhaps, he was still in school. The schools were still open 9 days ago. So as recently as 9 days ago, he was still in school. I don't want him to infect his grandparents or to risk infection by being with neighbors. So him staying with my husband is probably the best case scenario for us. So I think my biggest fear is separation from my daughter. I've been pregnant with her for 9 months, and she feels like a part of me. When you're pregnant, you're like, oh, I'm pregnant, right? And then even I remember when my son was born and he was in the next room, like getting cleaned up. It felt like my leg was in the next room because it's like part of you. So there's already this kind of trauma when birth happens for the baby and the mother, of separation, of pain, of drama, right? And so if then they were to, it's just hard to imagine that scenario. And even if intellectually I would understand the reasons to not want to risk her getting infected, it's still, that's like a hard pill to swallow. So
now you're talking to other mothers who are in the area, or just mothers nationwide who have similar.
Actually, all around the world, yeah.
Yeah, now they're doing this all over the world, and definitely like I just saw California is doing it too. How are the other mothers reacting? I mean,
this is social media. When my mom had my sisters, I remember she had like the what to expect when you're expecting books. But even 5 years ago when I had my son, those are all apps now. The app tells you like the baby's as big as a watermelon this week. And it also connects you to women all around the world. I think there's like 15,000 that are due during March that are talking to each other about like, how's it going where you are, or sharing your birth stories. So some of these women are freaking out. They're like suing the hospital. They're like, oh, I'm going to die without my husband there. They're going to have to arrest him. Some of them are just really, really freaking out about this news. I think maybe because I've had a kid before, I'm kind of like able to brace myself for that part of it. But I am seeing women that are being separated at birth from their newborns. One, I think I shared this with you earlier, one is still waiting for the results of her test, but because she has some of the symptoms, they're treating her as positive. And so they've separated her from her newborn, and she's sharing about that. She's only been able to see photos and videos. She hasn't, the baby was born yesterday morning, so like 36 hours ago, she hasn't been able to nurse him or to meet him or to see him. So that is, a gut-wrenching prospect for anyone that's spent, 9 months now as one with this other being. And then there's also the interesting thing is like the CDC and the WHO have different recommendations on both these counts. So the CDC is recommending no birth partners present, and also separation at birth if there's any doubt at all about the mother being positive. The WHO is saying that there are risks that outweigh the benefits of both of those things. That having a birth partner means, like, let's say you faint or something like that, and there's no nurse in the room and you're unable to call for help, that having somebody with you actually does help alleviate some of the risks that just come naturally with the childbirth experience. And that there'll be better outcomes if you are allowed a birth partner. Same thing with the separation of the child. They're saying that even if the child does become infected, being able to nurse, being able to bond with the mother, receiving the antibodies does outweigh the risk of getting COVID. So there's kind of like this really interesting, give and take between what the WHO is recommending and the CDC is recommending. And different hospital groups are making different decisions about this, and also facing getting sued and all kinds of crazy hormonal ladies like calling them and tweeting at them, and men like threatening to chain themselves to something. So it's quite it's quite a scene. It's going into the hospital knowing that you're about to be hospitalized when you're perfectly healthy in the midst of this crisis. Like, on the one hand, I'm glad that she's in there safe right now. I'm safe and comfortable at home. Going into the hospital feels like really dramatic. But she's going to have to come out really soon, no matter what.
It's crazy because, I saw this doula on CNN today being interviewed by Jake Tapper, and I'm a naturopathic type of person. Like, I am drinking my kombucha as I'm sitting here. I lead a very natural lifestyle. That's why we're friends. And my mom works in that space too. So she's here with me. And she mentioned that sometimes when the clear science is not weighed as heavily as the naturopathic science, when you're coming from the naturopath, it actually diminishes the strength of the naturopathic argument. Like in China, for instance, it's a more comprehensive, East meets West sort of philosophy, even in the medical system. So they're like testing Chinese herbs, and all medicine comes from herbs, actually. So, they're testing Chinese herbs and how they interact in terms of, finding some sort of cure or vaccine or whatever it would be. And the doula was like, it's really, really important that the mother is hugged. And like, I'm listening to this thinking, no, it's not right now. I'm sorry. Like, there's some things you have to throw out the window. I mean, it's horrible that you're preparing for this and you're meeting with your doula and you're building this relationship, and the doula is your advocate in the room traditionally, and that they have to live stream in. That's what they're doing right now. But on the other hand, it's not just about the mother's health or the baby's health. It's, of course, the hospital. And if a virus is brought in and the medical workers who are dealing with a very, extraordinary experience of childbirth in general, don't have the protective gear right now, it could, exacerbate. And I mean, it's just, she also mentioned that like if the mother tested positive, then the father is probably, or negative, then the father is probably negative and the child's negative. We know that's not true. We know I have friends who have loved ones and children who have tested positive and they're not positive and they live in the same house. It's sometimes you get the flu and your family member does, and you don't know why it happens that way. So, I mean, it's just, I think we have to be extra cautious right now when taking that medical advice. And I think, you've been extremely cautious, and partly because you're in a containment zone. And so they have had to exercise extraordinary caution because of the number of cases that have come out of that essentially one town, a couple of towns.
Right. Well, that is something. I have friends who are OBGYNs. I have friends who work in this hospital that I'm delivering at. And one thing that they're talking about is a lack of protective gear. I have a friend who posted a few days ago that she's down to one child-sized mask, and she doesn't have the ability to throw it out. She doesn't have any further supply. So that is certainly an issue. I mean, part of me feels better going to the hospital knowing that there are not going to be 30 other birth partners coming and going. I was in labor with my son for 46 hours, and my husband went and got pizza. He went and got a change of clothes. He was coming and going the whole time. And I feel like that's the only way you possibly could allow any birth partners, is if they were on lockdown, if they got tested upon arrival too, and they were not allowed to come and go or to leave. Right. But in a way, I feel safer, not having that. I think there are virtual doulas, and I've been getting a lot of really crazy advice too. Why don't you just have the baby at home? And I'm like,
I gave you that advice.
No, I mean, I would love to have the baby at home, but there's a lot of things to consider. First of all, midwifery practices do not take new patients after between 26 and 32 weeks. So if you're 40 weeks like me, there's no midwifery practice that is going to take a new patient that's full term. They want to build that relationship. They want to know you. They want to know your medical history. They're not going to just like show up on the day of and be there. They also, I have friends who had, or ladies in my birth group, who had home births planned, and they've been canceled because many midwives are not comfortable going into people's homes, not knowing that everyone in the household has been tested or if everything has been disinfected in the midst of a pandemic. And that's an awful lot to ask really of anybody either to put themselves in that position. It's also important to consider that not everyone has the square footage. Not everyone has multiple bathrooms and privacy. I have a 5-year-old son who is now not going to be able to go stay with family members or friends, who's here. Yes, that's the way it happened in the 1800s, where like the younger children got, an eyeful and an earful and the experience of birth in their face. But that not everyone has, the spare bedrooms, the spare bathrooms, and that ability to kind of host a home birth the way that you would want to ideally. Then you have women in the birth group that are like, they're not letting my husband come to the hospital. I'm going to just have an unassisted home birth, right? And it'll be on them if something goes wrong. And it's like, listen, I'm perfectly crunchy. I'm perfectly willing to give birth at home, but not unassisted. Like, I think that's also, sort of ridiculous. I will say too, my sister has a son that just turned 3 months old today. She had him in Switzerland, where they also, aromatherapy, acupuncture, acupressure, homeopathy. Doctors are not involved in the birthing process at all, unless something goes wrong, at all. It's all midwives. The midwives do home visits for 6 weeks afterwards. The other thing to note with this situation is that the longest that they're holding anyone after a vaginal birth is now 24 hours. When I gave birth 5 years ago, the minimum was 48 hours. So now the maximum is half the length of what the minimum was just a month ago, meaning, there is a higher risk for the infant and for the mother. At least I have the experience of having breastfed before, of having gone through labor before. So I'm likely to know, probably know my body better, know if I need help. But they are willing to discharge you now as soon as 6 hours after giving birth.
What?
Which is, you want to free up the bed. You want to be home with your family. You want your husband to meet the baby. But, you can barely walk at that point. So it is a lot, at the end of pregnancy, you already feel really out of control. You don't know when the baby's going to come, how the baby's going to come, if everything's going to work out. And so this situation, of course, makes you feel all the more panicked and powerless. And so I think I'm just trying to take it one step at a time, take it one day at a time, just take in all the unsolicited advice and just like breathe it out. But it is a lot. It is a lot to handle, and I especially feel for first-time mothers who are in this situation. But for me, and me, I'm a fighter. I get lots of causes, and I'm definitely a fighter. But I'm not going to be fighting to bring my husband in and to force that situation, because for, like you said, the healthcare professionals, I don't think that they need any more drama at this time. I think that if they didn't take this decision lightly, and it probably is best for me and the outcome for my baby. So,
I mean, Dominique, I give you all the credit for having that perspective right now. As you mentioned, even with the hormones, because that's real. It's a real thing. We're not being gendered here. Like, if you've experienced it, then it's a real thing. No, but it's this is unprecedented, and I'm just very grateful that you're thinking about not just the livelihood of your child and the health of your child and yourself, but also the medical community that's there, making sure everybody is okay and is really on the front lines. And as we're seeing, many are getting sick and worse in these times. So Dominique, thank you. Hopefully, baby comes out in a very easy way. There's no drama. There's no problems. A healthy birth, and hopefully it's quick.
And we'll be chatting soon. Well, I am hoping for tomorrow versus next week, because as we've discussed, just the situation's deteriorating rapidly, and if it's dramatic now that the nurses are all in hazmat suits, luckily there's still your own room, your own bed. I honestly just feel grateful in this climate, in this circumstance, to know that I have medical care, that I have a bed, that I have a private room. I feel incredibly grateful just to have those things. And every time I start feeling sorry for myself, I think of all the people in refugee camps, or all the people that are just, don't have access to ventilators, in this crazy situation
My mom was just
crazy
talking about
time to bring life into this world, but it'll be a story for her one day.
Hopefully it's a very happy story in the end, and I think it will be. And I'd like to have you back on to talk about that. Dominique, thank you. Dominique Shuminova, pregnant lady, political director. That was her joke. I'm not calling her that. I said, "What do you want to be called?" And she goes, "Pregnant lady." No, political director of Matriarch, political actor, super pregnant lady, and supporting Bernie. All right, Dominique, take care. Thanks.
Bye.